Hello everyone. I'm here again with another video on NCLEX RN test taking strategies. All of you must be aware of this NCLEX RN exam, which is mandatory test for working as a registered nurse in the USA or Canada. And you know that this is an objective type of questions this NCLEX RN exam contains. So to clear this exam in the first attempt, you need to have an idea about the type of questions and what all strategies you need to practice in clearing this exam. So let us see the strategies, and this is very much important to improve your skills. So please watch the video fully so that you will get a clear idea. So let us see the first strategy. So first one, avoid reading into the question. Okay, this is very much important, and you must be thinking how I can avoid reading into the question. So you can just read the question, don't read into the question. How you will do that? You need to focus only on the information given in the question. You read every word and choose the right answer. Okay, and sometimes there can be mostly some strategic words will be given which will guide you to the correct answer. They are immediate, initial, first, priority, side effect, or toxic effect. So, for example, you need to know which of the following is a side effect or toxic effect, which is asked. Okay, so it can be either side effect or toxic effect. So that word, that side effect or toxic effect, that word is considered as a strategic word, and that will help you to identify the right answer. Then next thing, always use the process of elimination. That means when you are given a question with 4 options, you can very easily eliminate 2 options. Okay, and you will be a little bit confused between 2 options, and there you can again use the other strategies which will help you to come to the final conclusion. Then understand the subject of the question. This is again very important. You need to know what is the context. Okay, so you know that there is an event, then there will be a question part and the options. So from the event of the question, you need to get the idea about the subject of the question. Then there can be some positive event query and negative event query. So when you look at a question, you need to understand whether this is a positive event query. Example, you need to know whether the question is asking about the side effect or toxic effect of the medication. Negative event query means it may ask you to find out the option which is not a toxic effect. Okay, so usually we will be answering questions like which of the following is a toxic effect of the medication, but in negative event query you will be asked to find out the option which is not the toxic effect. Then there is a very high chance for candidates to make mistakes in such questions, so beware. Then again, priority is very important. Always you will be asked to find out the priority. Okay, we'll see that in detail, how to prioritize options. And most of the questions you will be asked to find out the first step, or you'll be asked to find out the most important thing. Then how you will identify that. For that, we have 3 strategies. Okay, so the first one, you can follow ABC, that is airway, breathing, circulation. When you read the options, if there is any option which is related to airway or maintaining a patent airway, then that will be the correct answer. Okay, and if there are no options related to airway, then you can choose an option related to breathing. Then if that also is not there, then go with circulation. Then there can be some other types of questions which may include the steps of nursing process. There again, you can follow the steps of nursing process. So you look at the options, and if any of the options is related to assessment or indicating assessment, then that could be the right answer. And if there are no options which ask you to do any assessment, then you can go with analysis, or if that is not there, you go with implementation, and finally evaluation. So you can follow that order. Then last one is Maslow's hierarchy of needs. You must be familiar with this, and if you do not know, please read about this, and later I will be explaining all these things in detail in another video. So please keep watching my videos to get better understanding about your NCLEX RN exam. So regarding Maslow's hierarchy of needs, the basic need is physiological needs. In the options, if any option is indicating or talking about physiological needs, meeting physiological needs, most probably that can be the answer of your question. Okay, and there is nothing given about physiological needs, then it could be related to security needs, and that may include prevention of complications and things like that. Then the next step is social belonging or love and belonging, need for love and belonging, then need for self-esteem, then self-actualization. So in this order, you can proceed. Then next one is about therapeutic communication. This is again an important topic in NCLEX RN exam. There can be many questions related to it. So you need to have a thorough idea about the therapeutic communication and how to talk to a patient, what to talk and what not to talk. This is very much important. And you can just remember like this, you should give importance to the patient's thoughts, feelings, concerns, anxieties, and fears. This is very much important. Okay. Then coming to another task or another strategy, eliminating comparable or alike options. Here, let me explain you this. If there are two options which indicate same thing or both are similar, and if you, for example, you are looking at B and C options, and you feel that if I select B as the answer, then C also will be right because B and C say the same thing. Then you can very easily eliminate both options. Okay, you can look at A or D and you can select the right answer. Next one, eliminate options containing closed-ended words. Okay, there are certain words, for example, all, always, every, must, none, never, and only. These words are considered closed-ended words because it shows some extreme situation. None of the following, or every person should do this, or it is applicable only to this. Usually, your NCLEX RN questions will be related to the general or the common rules. Okay, then sentences or the options containing words like generally, commonly, usually can be right answers. So you can eliminate options containing such words. Now, the next one, look for umbrella option. That means if you feel that options B and C look almost similar, and more than that, you feel that this B option contains C option also. For example, if the B option is monitoring vital signs and C option says monitor BP. So BP also is a part of vital signs. So if you feel that any one of these two are correct, then very easily you can go with B, because if you choose B, that includes C also. Next one, an important thing, it is how you will use the guidelines for delegating and making assignments. In NCLEX RN exam, you may get some questions like which of the following task or which of the following patients will be assigned to this person or assigned to a registered nurse or assigned to, and here you must remember that you can assign a patient only to a registered nurse and to LPN or UAP. I will explain what it is. You can only delegate tasks to these people. A UAP is an unlicensed assistive personnel. Okay, and a LPN is a licensed practical nurse, and there will be a registered nurse, RN. Okay, so let us see. An unlicensed assistive personnel will be taking care of a patient's mobility needs or some exercises or maybe some hygiene needs, something like that. Okay, or even feeding. For example, non-invasive interventions such as skincare. So providing a bath or anything related to skincare, then exercises, assisting with the mobility, transferring, such things. The ambulation, grooming, hygiene measures, all these can be assigned to an unlicensed assistive personnel. Then next, a licensed practical nurse can perform all the tasks which a UAP can do, plus they can do some invasive tasks also, such as dressings, suctioning, urinary catheterization, then administering medications orally or subcutaneously, intramuscularly, or any other route, but intravenous route can be done only by the registered nurse. Okay, and also this licensed practical nurse can just attach piggyback also. Piggyback intravenous medication also may be done. And also this licensed practical nurse can reinforce health education, which is already given by the registered nurse. Then let us see the functions of a registered nurse. In fact, a registered nurse is the overall in charge, and she is the sole responsible person for any other UAP or licensed practical nurses' works. So a registered nurse can perform all the tasks performed by a licensed practical nurse or even UAP if there are no unlicensed assistive personnel is available. Plus, they can do all the steps in the nursing process. That is assessment and planning, analyzing, implementing and evaluating, and then supervising, initiating teaching. Okay, so a health education is initially given by registered nurse, then administering medications intravenously. So these are the functions of a registered nurse. Now, let us move on to another important topic, that is answering pharmacology questions. Okay, many of the candidates find this pharmacology questions as a bit confusing, or some people say, I forget this easily. So you can just keep in mind a few strategies that will definitely help you. So first thing, use your nursing knowledge. So if you know the signs and symptoms or the actions or side effects or toxic effects or even the right dose, the dose range and all, you can use that nursing knowledge. Then you can form a relationship between the diagnosis and the medication. Mostly in the question, if the question is about pharmacology or the medication, the diagnosis also may be mentioned. So you will get a clue that, okay, this medicine is for this diagnosis. So like that, you can try to form a relationship between the medication and the diagnosis. Then you determine the classification of the medication, which group it belongs to. Then recognize the common side effects associated with each medication, and mostly your question may be about toxic effects. So you should be able to differentiate between a side effect and a toxic effect. And you should remember that usually a side effect will be a mild effect and the toxic effect will always be a bit serious effect, and sometimes it can be a life-threatening effect. So if you are asked to find out the toxic effect from the given list, and you can choose the most serious clinical feature from that. Okay. Then learn medications that belong to a classification by commonalities. Okay, in their medication names, like atenolol or propranolol, you need to understand that that belongs to that LOL group. Then these are some pyramid points you can remember. Do not take antacid with any other medication. Okay, and usually you give antacid usually after food, and there should be a time gap of 1 hour between any antacid and any other medicine. Then do not crush an enteric-coated or sustained release tablets. So if any of the options ask you to crush a tablet, an enteric-coated tablet or a sustained release tablet, that answer will be wrong. Okay, then do not open a capsule. This is again important. Then this is another very important thing, because this can come under even therapeutic communication type of questions also. Please remember, a nurse or a patient cannot stop or change or start or adjust the dose of any medication, and that can be done only by the doctor. Okay, then another thing, a nurse can withhold a medication for some time, especially if you find that the patient has developed a toxicity of that medication. So a nurse can just withhold the medication temporarily, and that should be notified to the doctor also. Then also remember, no OTC drugs, over-the-counter medications or herbal preparations can be administered or can be advised to a patient without knowledge of the healthcare provider. This is again important. If the patient asks you some doubts regarding any of the over-the-counter medications or herbal preparations, you can always ask the patient to talk to the doctor regarding this. And also, we never encourage alcohol intake, and if there is any option supporting alcohol intake, that can be wrong. Then another one, avoid administering a drug if the dose is abnormal, or if you feel that the prescription is not clear or you cannot read the prescription. In such cases, no confusion, or you should not assume, or you should not guess, and you can just talk to the doctor regarding this. I hope this session was really helpful, and I wish all to clear your NCLEX RN exam in the first attempt, and thank you very much.